Doctors have read it. What was the wildest self-diagnoses a patient was actually right about? This is why I usually ask patients what they think is going on or if there is anything they're specifically worried about. Either I get a good idea, or I can figure out a way to make them feel better about their concern. Had a patient who came into the ED with vague mild abdominal pain whose friend recently died of colon cancer. She was convinced she must have it too. Told her cancer wasn't contagious like that, but ordered a CT scan because she was so insistent in order to reassure her. Lo and behold, she had a huge colon mass. Very bizarre case. Woman in her 40s came in and told me she was having seizures. I asked how she knew and she said her right hand would periodically stiffen. There was no loss of consciousness or other symptoms more associated with classic seizures, but I ordered tests anyway. Turns out she had been having multiple focal seizures. Not a doctor, but my aunt and uncle had a border collie that would bury his nose in my uncle's back when he was sitting on the couch or recliner. He would walk up, sniff and keep sniffing until my uncle would shoo him away. A bit later he would come back, sniff again and just stare at my uncle. A few weeks later my aunt was watching one of the local news channels and they featured a dog that could smell Parkinson's and she jokingly told my uncle about it. He mentioned their dog constantly sniffing one spot and one spot only on his back, so he went to a high school friend who was a doctor in dermatology. He said it didn't look right and did a biopsy on it. Sure enough, he had skin cancer, but they caught it early and all he ended up with was a scar on his back. Patient here. Told my family GP, who I'd seen since I was a kid, and who worked with and saw both my parents as patients for years, that I thought I had reactive hypoglycemia. He scoffed. You don't have that. Why would you think you have that? I told him my symptoms. He was doubtful, but told the nurse to get me a Coke and made me chug it. Sent me to roam around the hospital for a little bit, then get blood work and come back. I came back, and his first words were, "This is so aggravating. Does that mean I have it?" Yes, that means you have it. I'm a nurse, but just had a patient who came in for a colonoscopy due to constipation and pain with bowel movements. He told me prior to the test he felt like there was something catching on the left side of his abdomen when he pooped and was like, maybe I have a big polyp there or something. Sure enough, he ended up having a 2.5 centimeters polyp that we removed from that exact area. I'll never get to find out if that catching sensation ever went away for him, but I thought it was interesting that he was right. Had a patient come into the ED and told me he had epiglottitis, an uncommon infection of the epiglottis, part of your throat, when I went to see him. I asked how he knew he'd had it before but was also a 90-year-old retired ED doctor. He was right. Not a doctor, but in junior high I had a little cough that just wouldn't go away. My grandmother was convinced it was whooping cough. I felt totally fine, it was just an annoying cough. She made me go to the doctor and told the doctor that she thought I had whooping cough. The doctor informed her that it hadn't been in our area in over 10 years, so she doubted that was the case. My grandma forced her to test me for it anyway. Turned out I was positive and considered patient zero. The whole school basically ended up getting it and we had to shut down for 2 weeks until it went away. I work as a medical lab tech. We had a patient who came in insisting that her neighbor was poisoning her. Everyone dismissed her assuming she has some kind of paranoid psychosis. She remained in the ER on a psych eval. I ran all the standard labs on her and they were normal, but this patient would not budge. She was admitted to psych on a hold. At this point, one of the hospitalists decided, why not, and ordered labs to test for several heavy metals and ethylene glycol. Her ethylene glycol level was 32. IDK if she was legit being poisoned by her neighbor or if it was self-induced, but damn, that patient taught me a very important lesson that day. Me. Doctor, I have a kidney stone. Dr. No blood in urine, can't see anything on ultrasound. 3 days later. Me. My stone is causing me pain and cold sweating. Dr. Let's talk about an X-ray of your spine. Dr. There is a slight misalignment. Could be trapped nerve, referred to spinal surgeon. 2 days later. Me. Taking a piss, what the fuck was that? Me. Doctor, here is the 4 malum stone. Patient here, halfway though my cancer treatment, tell them it's back. No one but mom listened to me. After 2 months of non-stop telling them, they did a scan. Turns out yes, I had cancer again, and look, it was getting close to being terminal. The student doctor learned to listen that day. Patient, but I ran cross-country in college. My senior year my thigh aches. I told everyone something was wrong with my bone while being told it was a muscle issue. After being treated for every muscle issue in the book, I demanded an X-ray. I had a stress fracture more than halfway through my femur. Y'all, if you have anxiety, this isn't the thread for you. Patient here, I know, I'm sorry. I had been having various digestive troubles for a few weeks, but thought I was just recovering from food poisoning or at worst maybe developing something like IBS, IBD. One night while I was lying in bed with my hands on my stomach, I felt a lump. Instantly nervous, I started pacing around my house, Googling symptoms. Of course WebMD and various articles kept suggesting cancer, but of course it's never cancer. Well, it was cancer. Stage IVB ovarian to be exact. Whoops. Not a doctor, my friend diagnosed herself with HIV. She had swelling around her neck and the doctors weren't finding anything. She Googles her symptoms, calls me, says she thinks she is HIV positive. I spend the call trying to calm her down and telling her to get tested, but that probably isn't it. Her doctor also told her, there's no way, but she insisted on getting tested. Yep, she was right.